Having the Ministerial Panel today and my dear Ministers of Health, they will share with you all their experience in their own countries with the hope, of course, to open new challenges and find solution for the further issues can arise in Africa now and in the future.
With increased awareness, certainly there are more cases of cancer that were discovered. And as you all know, cancer is a specialized area. We need trained specialists, oncologists in this area. And at that time, Uganda had less than 20 trained oncologists in the country. I want to appreciate that with support from Merck, they have added on to the pool of trained oncologists. We have 5 so far now. 3 have completed, 2 are still ongoing, and we really hope that more will be trained. I also want to state that even the fertility side, Uganda is one of the countries with the first public hospital that is providing fertility care services to the population. Previously, fertility care was a private sector-led initiative by private doctors, and now we have the specialized women's hospital that is supposed to be providing fertility care. Still with the support from Merck, we have installed the equipment, but we have not yet started providing the services. We hope that before end of this year, that should be a reality.
Now, I want to pitch Merck Foundation as a strategic ally because they are speaking to fundamentals in our health system. In training 18 doctors in various fields of urogynecology, infertility services, and many other aspects of NCD training, they are also helping us entrench a sustainable human capital development program because these doctors, as they come back, they support continuous training of the other doctors that are within the country. And this is the only way we have hope to attain universal health coverage.
We are very happy to be partners to Merck Foundation and help to have many students from different countries in Africa to study in Egypt. And this comes under 4 decrees by the President Fattah al-Sisi for giving much care for international students from different African countries, especially with the chairmanship of African Union for 2019.
D'abord, je voudrais remercier la Fondation Merck d'Allemagne, la plus ancienne société pharmaceutique du monde, comme pourrait le dire, pour leur contribution au développement socio-économique de l'Afrique et de l'Asie.
In the last 3 months, we've been very lucky that through Bifai Malawi, Merck Foundation also came onto the scene. And we would like to thank the First Lady for having gotten in touch with Merck Foundation. Through this foundation, we are about to benefit enormously in the field of capacity building.
Alors nous avions un défi qui, grâce à la Fondation Merck, pourra trouver une solution durable parce que dans notre pays, nous avons assez d'infirmiers, assez de médecins généralistes, mais nous avons un manque criard de médecins spécialistes. Alors avec la Fondation Merck, le Burundi a bénéficié des bourses pour la spécialisation en fertilité et diabétologie, mais aussi actuellement nous avons, grâce à la Fondation Merck, d'autres médecins spécialistes qui vont commencer les études avec le mois de novembre.
Merck has been very instrumental in the training of oncologists. Already 1 is undergoing training in India, and 4 are being processed for training. For the fertility doctors, we've already have trained 3, and with the help of Merck, and another 4 are being processed to undergo training, and some are being trained on hypertension and diabetes.
This partnership training is focused more on non-communicable diseases like hypertension, diabetes, and cancers. Another capacity building area is fertility training as a result of increasing demand of services in this area. Under fertility, 7 specialists have been completed training in embryology, and we have Merck Foundation. We hope Merck Foundation will continue to provide us with more support in this area.
We have welcomed the Merck's program. We have trained about 3 or 4 infertility specialists through this program. And to begin with, I think we can take the approach where we can use them to start educating the communities, or talking to them about preventing infertility, and those who are already having the issue to be able to counsel them and make sure that things work better. So the community approach, while we are waiting and praying that we can get an infertility center of our own.
The country still has the gaps in terms of, firstly, trained specialists in cancer, diabetes mellitus, infertility, and hypertension. We definitely need those. Secondly, health facilities to offer specialized care in the same areas are required. And thirdly, there is need for us to come up with health financing mechanisms.
We, in the Ministry of Information, Civic Education, and Communications Technology, we are very appreciative to your initiative, because you saw it needful to involve us, that we are one of the components through channels through which we can disseminate information. We use different avenues in order to reach out to people in the communities with relevant information. One of which is organizing television documentaries. These are organized, they are put together, wrapped together in local languages, because there are various languages that are spoken in Malawi, and they're distributed in media houses, private and public media houses, and they're aired free of charge. So these documentaries contain the themes, and part of which these to do with stigma faced by people with, with infertility issues.
As you already mentioned, the Minister of Education was privileged to receive 18,000 books, a Limbani story, a very exciting story. For the students that have already read this book, it's very exciting, and it's a popular book. We're looking forward to having so many stories of that nature in Malawi. It has actually added a different dimension, other than just reading the traditional textbooks that are on the curriculum. This gives a different dimension altogether.
We shouldn't let barrenness be an issue. Infertility should not be a stigma. A lot of women are going mental because of infertility. That is why we are grooming the young men and women at this stage, so that when they grow up, they will not only see childbearing as marriage. Marriage goes beyond childbearing. When children come into marriage, we thank God. If they don't come into marriage, we cannot blame anybody. We have to help each other. Give your wife a shoulder to cry on. If it is the man's fault, women also give the man a shoulder to cry on. And then after crying, what do? We want a baby, let's go get a baby. How do we get a baby? The ministry helps in adoption.
The Malawi government has put in place legal frameworks and policy measures aimed at safeguarding the rights of women and girls from all forms of violence at all levels, regardless of their status.
This has really been a very interesting session for me because we hear what people are doing to educate, to innovate in a way that gets across our message. Now, the main message I think we have here is to delete the infertility stigmata but you should be aware that there are many other things in which I think we can do at the same time that we're doing that. So if we're trying to get the message across that males are truly responsible for 50% of the infertility, or at least they must be treated, as Professor Ashira has mentioned many times, this is an adult-to-adult conversation. This is not necessarily something in which we expect the ball to be carried by people in junior high school or in grade school.
I have, forged a lot of friendships with a lot of the doctors in different parts of Africa. And believe me, when I came in here and I suddenly saw so many of them coming and saying, I need a selfie by you, and I need this, and I need that. I felt that, that was so important. And 5 people have actually started IVF centers in Africa, which is again another important thing.
We now have a powerful force. This African luminary, I'm getting to know my neighboring Africans. We now should form a powerful team because we're talking about these 360 degrees. It must be horizontal integration and vertical integration. So we should harness the energy of this gathering every year, not just we just go and go back home. We should network and make Africa big.
FIGO is really seized with the need for the knowledge to be transmitted to Africa, given to Africa.